Hello and welcome to the 4th episode of Know Your Blood, Know Your Health. As always, I am your host and companion on this journey, Uchenna Amadi, and I'm still with the one and only Dr. Adewoyin, a consultant hematologist. He has been very instrumental in this podcast. I am privileged to be learning from him today. So in the previous episodes, we talked about understanding our blood groups. Then we went on to talk about blood groups, nutrition, disease risks. Then we moved to blood groups, pregnancy and reproductive health, where we talked about couples, and their roles when it comes to their compatibility, the resource of the man and the woman and the effect it has to on the child. Which brings me to what I wanted to ask. Dr. Adewoyin, this thing you talked about, this resource, can it play a role in paternity testing?
Yes. So historically, blood group antigens were actually used in determining paternity.
Blood group?
Correct. As a
Small
matter of
blood
fact,
group.
Absolutely. It has some relevance.
Wow.
It's just that now we've got a lot more biomarkers that are stronger in terms of prediction. This parentage paternity thing that we do is a prediction analysis.
Okay.
So you always see us, we report as probability that the likelihood of this is this, based on these parameters. So there are much more stronger parameters now, or biomarkers that are much more specific, for parentage analysis or paternity testing, as we often call it. But certainly blood group has some relevance.
How?
The relevance is probably just about, by statistics, about 30%.
Okay.
But take a scenario. If a patient comes to me and says, look, my child is resource positive. And then we check the father, and the father is resource negative, which means that the father has the resource factor, the D antigen. And the mom, or we check the father is resource negative, RHD negative. We check the mom is negative.
But the child is positive.
By genetics,
that child is not their own.
That child, we don't know where it's coming from. So as simple as even the resource factor can help to include and exclude, and we also know that these are inherited genes. They are not genes that we acquire. They don't mutate. They are genes that are transferred. So we can't talk about, there was a mutation in the child. That's why the child is positive.
This is serious.
So if the father didn't have it, which means it's DD, small d, which means there's because it's a dominant gene. So if it's there, it will express itself.
Yes.
The mother has got, the mother doesn't have the D antigen, it's DD, small dd. If it's not there, it's not there. The father is not there, it's not there. So where's the child getting it from? So somebody has played a away match. That is what it means. So those are relevance of blood group antigens, even in parentage or paternity testing.
That is...
Although it's a weak level evidence, probably about 30% strength of evidence, but there are a lot more markers that can be done. But even as simple as blood group can shade and unshade things.
Wow. Yeah. That's all I can say. Because you have opened... Yeah. Don't worry. Let me not even go there. Wow. That's actually an interesting thing to, take away from here. In this episode, I told you, fire for fire. In this episode, we're going to be talking about blood donation, transfusion, and life-saving acts. Please do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and on Spotify. So, Dr. Adewoyin, I want to ask, how important is blood group compatibility during transfusion? I know you talked about some, when you said something about the universal donors. Right. Some may be having the hemolysins that can... Yes. So how important is the compatibility during transfusion? Because that part was quite scary.
Yeah, it is very important. I'm trying to weigh the strength of importance that I should attach to this. Yeah, because it is very important. In fact, you can't do a successful transfusion without blood group and matching blood group. You can't. If you remember the early days of transfusion, where we thought that because by virtue of evolution, animals and humans have some similarity.
Yes.
There are those trial transfusions that happen in those decades, several decades back, where even animal blood was given to humans. And then, of course, went quite bad because that's how we got to understand that, no, even the animal blood groups are different. There are some similarities. I mean, we are probably close, like 97%, homology, but there are differences. As a matter of fact, that resource factor was actually discovered in rhesus monkeys because they thought we are close, so they assumed that.
Say they thought we are close?
They thought we are close, monkeys and human beings, so that is why, but now, in technical terms, we are not close.
We are not close.
Even the so-called resource, we still retain it now, but then more technically, that blood group system is called RH now. So I don't have resource, in layman term for public communication, we still say resource factor. But really, what we're talking about is RHD, which is what is in humans, and then we left that resource, in the
for
animal
the
kingdom, so that they can have their own labelings, So so the blood group system is very key. In fact, it's the pivot on which transition medicine runs. Without blood group, we can't do anything. So the first thing when we even want to determine transfusion, what blood to give, is even the blood group, ABO and RHD. That is very, very important. And we talk about compatibility.
Yes.
So you hear something like, the blood group this blood is group compatible, is group identical. That's what we're trying to do, to be sure that there is matching between the blood you want to give, that's the donor blood, and the person that will receive the blood. So there are a lot of what we call pre-transfusion experiments or trial transfusions that we do on the bench in the lab to establish the degree of match between that recipient, the patient, and the donor, the blood that we're trying to prepare and cross-match and give to the person. So without blood group, there's no transfusion. It's as simple as that. It is very important. And then the blood group that we'll be giving must be a blood group that matches. And then maybe I should mention too that there are even blood group antigens that are not ABO, that are not RH or resource, that are also important and can cause transition reactions, and they are not related to. Although we call them minor, so they are the concept of the major blood group antigens, and then we call them minor. But even those minor can cause havoc.
Wow.
So we are mindful of them when we are doing our pre-transition compatibility checks.
Wow. That's quite interesting. So speaking of blood donations, I'd like to ask, who can donate blood and how can one safely donate blood?
Who can donate blood? Any adult who is fit should donate
is
blood.
Relative, though.
Yes. So any adult who is fit should donate blood. And when we say adult, by Nigeria legal definition, fitness, adult is 18 and above. So anybody in 18 years of age and above can walk into a blood donor clinic and say, look, I want to donate. Now, must be an adult, must be fit. When we say fit, there are what we call criteria for fitness, or we call donor eligibility criteria. So usually the process that you walk into a donor clinic, I want to donate blood. I was in Brussels one time in Belgium, and I said, I know I've been donating blood in Nigeria. So I was just passing through one of the streets. I saw a blood donor clinic. So I walked in, I want to donate blood, So they ran me through their checks. Very enticing environment, candies everywhere, water,
Candies.
In fact, I was welcomed with a gift, there was a stress ball, just very homely environment. So I walked in there. So they gave me a questionnaire. I filled it. So where are you coming from? And all of those. So of course, I was visiting for a conference. And then they ran through their eligibility criteria. Everything was good except that I had not resided in the country for long enough,
Wow.
And so I was bounced out, of that donation exercise.
Wow.
So what they call donor deferral, it's a temporary donor deferral.
Okay.
Now, so I'm trying to talk about what we call fitness for donation.
Yes.
Now, for you to donate, there are certain minimum requirements that we expect. One is that before you donate, you must have enough blood now. So you cannot come and give what you don't have. So that's the first thing we check. That, this guy or this lady has got enough blood to even spare. Because when you are donating, you are giving roughly 10% of your blood volume. We've got about 4 or 5 liters of blood. Men have more blood, because we've got more blood. Now, so you're going to check that you even have enough so that I can
Enough
spare
and to
10%. Yes,
Yes.
to spare. So that's the first thing we check. And we have that by just checking your blood level. The other thing we check is that we will not want to collect blood, and then transfer infection. So we want to check that, this blood is HIV free, is hepatitis free, it's syphilis free, because it won't be fair that you want to give an infected blood to somebody who is already sick. It's what we call, beneficence and non-maleficence.
Yes.
You don't want to contribute more problem to somebody you are trying to help.
Yes.
So it's important to have all those checks. Of course, we take history to say, look, do you have this chronic health condition? For instance, someone who is epileptic, we're not sure whether it's well controlled or not. So if you collect blood and the person goes into an epileptic fit, that's not a good, blood pressure is very uncontrolled. You're not going to collect blood because that person is not, in a fit. So there are all these criteria. And then we also don't want the donor to run into problems. So if you've donated in the last 1 month blood, red cells, we will not collect that blood. Because if you are donating every month, you're going to get depleted yourself. You're going to get short of blood and you will need the blood.
Thank you for saying
Situations
this.
have happened where we are taking blood. The person collapsed and we are returning the blood. With the rush and the blood, but I say may not die for hand. So these are not very interesting, situations. So it's always a very, very important thing.
But that thing comes from a place of greed.
Correct.
Sometimes people feel they are selling their blood.
Yeah.
Some people get incentives for donating. So they feel like every month, it don't reach. Let me eat plenty amala. Let me eat plenty vegetable. Let me go and donate.
Right.
But it's good that we're talking about it now so that people don't think that they are doing it and harm is not coming when you keep giving and not replacing. Because I think the red cells takes how many days to...
The lifespan is about 100 to 120 days, roughly 3-4 months.
And then somebody just does in January and goes again in February and goes again in March.
So that's counterproductive.
Dangerous.
This thing
so you have to return the blood.
Yeah, we'll return the blood. We must, donor health. The donor must be alive and well. This thing reminds me about selling eggs too. It's trending now.
Yes.
People are selling eggs.
That's scary.
They're overselling their eggs.
Yes.
And then that's going to be counterproductive in the long run.
That's scary. So, we just talked about this last week.
Right?
That's actually scary. A lot of people, and they're targeting secondary school.
Right.
Oh, God.
Yeah. They're not even up to the age where they should, because if you are less than 18, you can't even give consent by law. You can't give consent by law.
Wow.
Yeah.
That's scary.
So again, all blood donors, what we encourage is at least 3 months apart, 3 times a year. So that makes you a regular blood donor.
Wow.
So at least 3 months apart, 3 times. So that way, and you are eating well, no health issues, you would be fine, and you can be a regular donor. You just pop into the blood bank or the blood clinic, donor clinic, and then give a unit of blood, 30 minutes plus or minus to 1 hour, you're done. We just allow you rest and make you comfortable, and then you're off. Of course, you don't just jump off and go and start driving tractor or strenuous job.
Dr. Adewoyin, let me confess, because in my service here, so there was this client that needed surgery.
Correct.
And I decided to donate. And I'm also on duty. So we're 2 of us on duty. So one person finished and we're like, okay, I didn't rest.
Right.
I stood up and I fell.
Yeah.
Like,
your sisters. Right?
I fell. Wow.
Yeah.
And that was a huge lesson for me.
Right.
It was actually my first time donating.
Yeah.
And so that means it's actually important to rest.
It's important.
After.
You don't just jump off from the donor chair, because we've taken 10% from you.
Wow.
So that volume needs to be managed. It needs to equilibrate, you know. So we always hydrate a lot too. We tell you drink water. You can't come and donate fasting, no. You're going to run into problems, you know. So those are things we check.
These are
when
things
you
that
take your
people
last
don't
meal,
even know.
we tick all these boxes.
Wow.
You know, don't take alcohol. Alcohol is going to dehydrate you, you know. And people that know, they trick us with these things. So you can see people, especially people that we call blood touts or commercial donors, they will drink alcohol to dehydrate. And then they come in, you check their blood level, their HB looks good. But it's because of the alcohol, because it has dehydrated them. You know, so you collect the blood. Now we have the blood in the blood bank, and we're like, this blood is anemic. Even the donor, the blood you want to use to help somebody, the blood self short. You know, so it's a cause of transfusion refractoriness. You give blood, PCV was 20%. You give the blood, the PCV is still 20%. That's why, because the quality of the blood is not good.
Yes.
So these are things. But again, it's a survival economy. People are not thriving. So even if it's 10K or 5K or the plate of food, people will do anything to.
Yes.
Yeah. So that's what tends to contribute here. But again, we keep educating.
Wow. Thank you very much for this. So I would like us to speak on universal donor and universal recipients. Who are they?
Right. So we say the blood group O is a donor, universal donor, because the person lacks A and lacks the B antigen. So you can give your blood because you lack the antigens, but you have the corresponding antibodies. And the antibodies that you have, they are anti-A, anti-B, but they are IgM. They shouldn't cause problem. They are naturally occurring antibodies because we just have them. But there are some people who have this IgG, anti-A and anti-B. Those are the hemolysis. So those ones are not, we call them dangerous O donors. And that's why I was trying to debunk when we were talking about myths and misconceptions that look, it's not every O that is safe. There are some O blood group that can be risky donors, and we need to be able to identify them. In a standard blood banking transfusion service, those are checks that are done. And then AB people, because they don't have anti-A and anti-B, they are considered they can receive from anybody because there are no antibodies in them that can damage even when they receive other blood group antigens. So that's the concept of universal donor and universal recipient.
Okay. Then I wanted to ask how blood banks manage rare blood types during emergencies. For those rare, you mentioned something about the bands that you give so that people are aware in case of emergencies. But the blood banks themselves, how do they do that?
Yeah, so we keep registries.
Okay.
So what that means is that we try to keep a register of people who have these rare blood groups, so that when we need them, we can call on them. We have their contacts. We can say, look, we've got an emergency in the spirit of saving life, altruism. Please, are you available? We will need this. This is the situation.
Wow, kudos to them.
Yes, registers are kept, and then you can reach out and say yes, But even before the emergencies, there are things like that, what we call deposits, blood deposits, So before you run into an emergency, if you know you have a rare blood type, you can deposit your blood. So you want to have a surgery, maybe an orthopedic surgery, it's a planned surgery.
You can come in before. Wow.
Yeah, it's autologous donation. Yeah, you're donating for yourself. Your PCV blood level is very good. You're going to donate, but that blood is for yourself. It's all autologous. Yeah, so we're going to keep it within a safe period, and that surgery must happen within that safe period. So that in event of an emergency need, during that surgery, we can collect the blood, retrieve the blood from the blood bank, and return your blood to you to salvage the situation.
Nice.
And sometimes you can keep up to 2 units from the person.
Nice.
So there are protocols around that, pre-deposit, normal volumic hemodilution and things like that. What we just keep, and then we just keep the blood, in readiness for an emergency need. So things like that are available and they can be achieved in our
I wanted to even ask, the autologous donation, does it require, would you have to run the matching again, the cross-matching on it before you return it to the owner?
The protocols are there, also depend on institutions, and sometimes it's just to be sure that there are no clerical errors. So you need to just check. You know this person,
like double checking.
But it's like a double check, just to be sure there are no clerical errors. Because
that's actually impressive.
To err is human, errors will happen.
Another punchline.
Yeah.
Okay, Dr. Adewoyin, how can we encourage people to donate blood? How can we encourage more donors? Not commercial now.
Yeah, this is a big topic. Very big topic. In fact, it's a very big topic. Even discussed on global fronts. Because a lot of us, especially in developing economies, we don't have that culture or tradition of just working. In the Western world, that education knowledge is there. It's handed over from family to family. You've seen your dad saying, no, I'm going to go donate. Your mom goes to donate regularly. The children imbibe the culture, but here it's not a culture, and so that culture change, that's, paradigm shift, people saying, look, this is not about me. It's about the next person, and we need to have a pool of blood, a blood stock in case of emergency. Anybody can have an emergency. Somebody had a power bike accident, somewhere on Ozumba and by the way, and probably had a cut with bled out with, maybe exsanguination, and then the outcome was fatal, So if there are not enough blood, you would have seen and read of situations where why this person died is because there was no blood. And they were running from hospital A to hospital B, checking from blood bank A to blood bank B, trying to salvage the situation, but blood didn't come on time. By the time the blood would arrive, the patient had departed. So this underscores why we all need to be regular donors. We need to just go in. If you are good enough, fit enough to donate, it's a 30 minutes, 1 hour thing every 3 months, and you are going to be saving 3 lives from there. Because blood can be separated into components. And we do what we call blood component therapies now. So you just give the specific component that is needed. So people need to be aware, that this, is what we can do. It's just in the spirit of we are brothers and sisters and we need to help ourselves. The challenge sometimes is that people have the concern that even if I donate voluntarily, somebody else is trading the blood and selling the blood and making money off that, but I think we should grow beyond that on a personal front because for me, it's donating not because somebody is making money from that. It is donating because I'm trying to save life, and I do not believe my reward is coming from the person receiving the blood or from the system. My reward is coming from me as a person, and I'm trying to help other souls and keep other people, help other people in need. So that for me is the joy. That for me is the satisfaction, not even because somebody is making money off my head. So I would encourage anybody. In fact, if you're, like I usually joke, if you're an adult without any health concerns and you have not donated blood before, it is a sin. In this kind of economy where we are, you have not been donating blood. In this kind of system, it is a sin. But that's just an enlightenment.
Yeah, I understand. But it's amazing to know that a pint of blood can save 3 lives.
Absolutely.
Because you can actually store them in components.
Right.
Wow. Well, there you have it. It has been an amazing discussion. Sadly, we have come to the end of this insightful podcast. If you're interested in knowing more about blood donation, go back and listen to our podcast, Save Blood, Saves Lives. So thank you for joining us in this journey through the world of blood groups, from understanding your type, its role, the nutrition, pregnancy, donation. Your blood tells a powerful story. And to Dr. Adewoyin, I would like to say a big thank you for coming here. As our tradition, I would like for you to sign on our legacy board.
Absolutely.
Yes, this shows that you came and you graced us with your presence and you shared your expertise with us. To the listener out there, do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and on Spotify. Know that you can also follow Synlab Nigeria across all social media platforms. Remember to stay informed and stay safe. My name is Uchenna Amadi, and I'm signing off.